Brought your wallets, $5 for a picture. Right there, we've already collected a decent amount of money. We're happy about that. We're gonna make that contribution, and I'm gonna match it. So let's see how big enough it is. But there's a lot of other things going on. One thing that the department has been very focused on is models of care here and models of care around the globe that really are effective in engaging people in an honest, equitable way as a part of healing and embracing people so that we're not having to deal with the kind of access issues that we have everywhere we go. Because if we're a kind and friendly and welcoming department and county, people are going to want to come to us. They're going to want the resources that we have available to help. Peer Resource Center, when I showed up here a year and a half ago, a little bit more, maybe a year and 3/4 now, definitely feels like a decade, was actually filled with boxes and tools and other things, furniture that wasn't being used, a lot of dust. And that window right there was covered with steel guards that are still there and close it down at night, as well as a chain link fence around the corner. And I was really kind of surprised that we had this amazing potential space that could provide what they like to call in Italy hospitality. Hospitality, imagine that, right? Imagine that in a government agency. So we started by opening up the spot over there, that other half, and that was kind of a big deal. And it wasn't just the work, it was actually people believing that we could do stuff like that. It may seem like a small thing, but it wasn't. And it's a part of what we're trying to do in this department, which is to shift our culture. And to get our culture to be a warm culture, a caring culture, one that leads with the heart. Heart forward, right? It's on the window. It's right up there. And it's in all of us. But the only way we can really put it out there is if we understand it, we embrace it every day. Not just in the field, but in all of the leadership. And that's where I come from. And that's what I want to try to move the department towards. And it's interesting because we have individuals here with us from Europe that are going to come up and talk after me, who really define this approach to mental illness. And they've done it in a way that is multi-generational at this point. And these are the global leaders, these individuals, and I think the one that will be following me next will be Roberto Mazzina, who's my counterpart in Trieste, Italy, and you should read about Trieste, Italy and the mental health system. All he talks about is the heart. So what we have here is kind of a transatlantic heart exchange. Yeah. And I just want to leave it with that. We have a number of good guests here who have come to Los Angeles, this massive jurisdiction. You know, the epicenter of need in our country, and also in many ways the richest part of our country. And what did we do? Where's the first place we took them? Where did we parachute them in?
Skid Row.
Skid Row. And we did that for a reason, because of the gravity of the situation and the humanitarian crisis in Los Angeles County. And they can tell you about it in a way that's much more real through their eyes, because they're the ones that saw it. But I think it affected them in a significant way. And we are now a part of an official collaboration with the World Health Organization. We signed this past week the Department of Mental Health for Los Angeles County to be a part of a World Health Organization collaborative that embraces a whole person approach to care. You guys get to see me talk down here plenty. I love the turnout. I love all of these faces. Many of them new. Many have been here for a while. The peers are doing incredible work to create hospitality and a whole different type of access and service ethos. Thank you very much. And Roberto, I'm handing it off to you, buddy.
Okay.
great pleasure and honor to be here. Sorry for my poor English, American. È più facile parlare italiano. Anyway, capisci. So che qualcuno capisce. No, I think it's a great privilege to be here to see all the services from Skid Row to Twin Towers, which are at the edge, but they are the core of the contradiction of this society, the system, this great community that Los Angeles has is seen as one of the global leaders as a city, as a community. But unfortunately, the mental health system needs to be anyway enhanced, maybe changed. I've seen a lot of potential resources that can be mobilized, and a great deal of people engaged and really passionate for change. And starting from the police staff, incredibly, they can teach us a lot, and we are going to invite them in Trieste to teach our police how they can engage people in crisis in a very humane way, including the homeless team, the outreach team of the police, which is incredibly based on values and not on the idea of security and force. So that's great. And we have seen people in services, people in NGOs really fighting hard to improve the system. We have a very different organization in Trieste. We have a community-based system that completely overcome the institutional facilities, no locked places. Everything is easy accessible. We have a community mental health center in each community area of about 60,000 population, so small-scale services well known by the population. That population can go, or we outreach people who don't want to come to the service when they are referred to us by different agencies or neighbors or families themselves, and we try to ensure the pathway of care toward not just treatment, which is important, but a project for the life of the person which is in troubles, in mental problems. So I think this is one of the responsibility of the service. So we think public services must be responsible, and then from that position be accountable, engage all the other agencies that are required to have a social inclusion pathway, a recovery pathway for people with mental problems. So families are a great resource for us. So we work with the family from the beginning. Today we were shocked to listen to some stories of some of the parents who are also here because clients who are on the street, they belong also to middle and upper classes. Not just the issue of poverty to be on the street. This is what they didn't understand before. So you become poor because of mental illness, because of untreated condition, because of something that has not been helped. So we can see people in the streets as the effect, unfortunately, the negative effect of a system which doesn't work properly. So it needs to be reconfigured, and we had a lot of talk with Jonathan Sherin, with Carolyn Kelly, with Kerry Morrison, with all the team of our friends here. Now we can say friends because we are really very much close. And so I think there is a great, and it's an enormous amount of energy, and I perceive also here in this room. So I think this is just the start of a journey of exciting collaboration. We are very proud to say that we are trying to work with people in Los Angeles to learn from them, but also to help this city to have the service that they deserve, because this is a great society with a lot of it's a multiple ethnicity here, ethnic composition, with a lot of disparities, of course, in classes, but with a lot of hope for a better life. And I think this is the issue for mental health services, to help people with mental health problems, particularly those with severe conditions, to have a life, the right to have a life. Thank you.
Right to have a life.
Hi.
Hi.
I'm Tommaso Bonavigo. I'm a psychiatrist, and I work in one of the community mental health centers that Dr. Mezzina talked to you about. Yeah, thank you for this hospitality and to be here with you, to have this week of visiting the different services and knowing people, clinicians, users, consumers, family members, and other services, the authorities, and yeah, it has been an incredible journey in your city. What to say? That's, yeah, that is different. Everything is completely different from Trieste. It's different. The size, these disparities are different from our city. Are different also the way in which the services are organized. But in the end, what is similar, what is the same are the people. And I think that we all are here, we all are people, and we all have to stay, not only to work, but also to stay with people. And what I think is that if there is this possibility to change the mental health services, maybe there is also the possibility to change the way in which the city stay together, people stay together in the city. And yeah, there are many challenges, but I think it is possible to work together and to do something. Probably, yeah, everything is big. It has been my first impression in my arrival here last Saturday, but yeah, in the end it is possible to work on a small scale every time, and so it is possible, I think, to put together, to keep together different people and different services, different stakeholders, and all together start on small sizes to make a change, to change the situation. And I think that we all are here also for this, to imagine together with you how we can help you and what you want to do. So I thank you for this possibility also.
Thank you.